Hi, welcome. Today we're going to talk to you about our Innovation Fund opportunity with Best Starts for Kids. And I'm Marcy Miller. I'm the Strategic Advisor for Help Me Grow.
And I'm Shu Criollo, part of the Prenatal to 5 team and Developmental Disabilities Division.
And together we've been working with many partners on the internal partners and external partners on this Innovation Fund that we're here to tell you about. And so Shukri is going to kick it off for us today and give us a little framing.
Great. So I'll give you a quick overview of the agenda. We're going to talk about what is Best Starts for Kids, why the Innovation Fund, give you information about the funding details, our evaluation, and some technical support that's available through this RFP, and lastly, our partnership with the Center on the Developing Child. So Best Starts for Kids is an initiative that builds on the strength of families and communities so that more babies are born healthy, more children thrive and establish a strong foundation for life, and more young people grow into happy, healthy adults. Our vision is that we want to see more babies born healthy, we want to see more kids thrive, and more young people grow up to be happy and healthy, successful adults. We are building on strengths and the resilience of our communities, and we have the most comprehensive approach to child development in the nation. So how do we do it? Basically, we want to increase the good and decrease the bad and intervene when needed. We want to invest in promotion. We all know that begins before birth and throughout life. We're interested in increasing positive resources, relationships, opportunities, and environment.
Now you can see us
Now
again.
you can see us. We believe in transparency. Now you can see us. We clearly and consistently communicate about Best Starts, structure, any decision-making process, and a path forward, which grows strong and trusting relationships and opportunities. And we want to recognize historic and structural inequities and seek to contribute to systemic and structural solutions that are desired by communities most impacted by those disparities. We continuously inquire and examine the equity impact of standard county practices on the communities that we serve. So we have some underlying principles, as I mentioned, equity. We recognize structures and inequities, and we seek to improve it. Our work is relational. We work alongside communities to find out what is going well. And we believe in a multi-generational approach to this work. It's important that we invest in resilience and protective factors that help move us forward. The levy detailed, so the Best Starts for Kids was passed in November 2015. It's a 6-year levy that was passed in 2015, so January 2016 to December 2021. And our implementation plan and budget was approved late fall 2016. Our structure was guided by deep community involvement. We had 2,000 community members that directly shaped Best Starts for Kids approach. And Best Starts is an overall cohesive strategy with 4 focus areas. We invest early before the age of 5. We make investments at critical points before the age of 24. We believe in healthy communities to ensure that all children and youth have opportunities to live in thriving homes, schools, and communities. And data and evaluation is key to this, and this helps us to find out what's going well and areas that we need to improve on. So I'll kick it off to Marcy.
So, as Shukri stated, community was so important in shaping Best Starts for kids. And as we engaged with community let us know that innovations were so important, specifically in our prenatal to 5 area. So how we are defining an innovation is a new approach or an existing approach that's been used in a different way. And what I would say is that we started out with some feedback from all of you, and things that we knew is that existing evidence-based and sometimes evidence-based informed models don't work for all communities. We know that there has to be a strong fit with what community needs, and that what the evidence provides, these models are sometimes less effective in producing outcomes for the families from the communities. We know that stakeholders within communities must take the lead in identifying their challenges and solutions. We know that the challenges that communities face are often best we know that challenges that are faced are often best equipped by those with resources and methods to create change, but people aren't always provided with the resources that are needed. And we also know that systems change takes time, and it doesn't always work, and we really need the voices of the families and the community represented there. So again, this is really we used all this information to think about how could we make sure that we have a good approach or opportunity for innovation. Next. So as we engaged with our community, we also knew that there were a couple areas that really had opportunities for innovations. And we really were thinking in 3 different ways, 3 different approaches for funding. And the first is to support families and children, supporting children and families. So we're really looking for opportunities to fund programs that serve children and families, again, families with children prenatally to age 5. And again, we're seeking new opportunities or new approaches that have been adapted to meet the needs of the focused population. And our goal is to ensure all along the way that community has been a part of identifying this aspiration or the innovation, and that they will continue to be involved in that solution. Another thing we heard loud and clear from all of you is that as professionals working in the prenatal to 5 arena, we really also need support for all of us working in that area. So we're looking to support professionals who serve children and families to ensure that they have high quality care for children and families. So this could be peer learning, training, and it could be demonstrating the service providers we want to ensure that service providers or the professionals are really also shaping that solution or innovation. And then we know systems changes. We're really looking to fund efforts to break down institutional and structural racism within systems that make policies for or touch the lives of families and children prenatally to age 5. They may build upon relationships with new or non-traditional partners, and they must ensure that communities that are most affected are helping create the solution. You can go to the next slide. So specifically, we have an interesting approach here where we're doing the first phase, which is going to be between October to March for 6 months, and we're going to give all awarded grantees $50,000 to engage with us. And what that really looks like is that during this time, you'll have the opportunity to partner with some of our incredible partners that you'll be meeting soon on a different webinar this afternoon to help support us in that time and for thinking and planning and documentation. We want you to have a good idea, but we'll be able to continue to shape and fund what that looks like in phase 1. In phase 2, you'll have the opportunity to do your ongoing, begin implementation. And we also recognize that it's really hard to start a new program, so we're going to ensure that everybody has $25,000 for startup funds that first year, and then they will continue to do their implementation. And then phase 3 could be looked at as the third year will be $150,000 to ongoing implementation, and you'll be able to do that ongoing implementation and make small improvements along the way to ensure that your program is meeting the needs of your community. So we can go to the next slide. So how we're going to do this is we have an exciting opportunity to utilize what's called the Ideas Impact Framework. And everybody who is awarded in the first 6 months will have the opportunity to go to the training on October 15th. And it's actually required that everybody goes. So mark your calendars now. And you'll be bringing a team with you, and that team will have the opportunity to engage with the Ideas Impact Framework, get training on what that means, get training on how, what that first 6 months will look like. And then your team will have the opportunity to either go on October 16th and 17th for 2 more additional days, or the 18th and 19th. So we'll break it up into smaller groups. During this time, your first 6 months, you'll be creating a theory of change on the program or the system or the peer-to-peer learning that you'll be engaging in, this innovation. You're also going to create documents that really show what you're doing, to document the good work that's happening, and have technical assistance and capacity building to do that work. You'll also have the opportunity to create an evaluation plan. We know that it's so critical. Sarah J will be talking about that later, that we have an evaluation plan for ensuring that we have good work going on. And then a budget. You'll be creating a program budget. One thing I want to say about your budget is you'll notice in your RFP, in the request for proposals, that we ask you to do a 3-year budget. And I want to say that this is an area that's not scored. We want you to be thinking about this budget, but I wouldn't put a ton of time and worry into this, because you'll, again, as you further develop your program and your great innovation, you will have more time to do that budget. But we do want you to begin thinking about that. So we can go to the next slide. So Best Starts for Kids all along has had 3 really important funding priorities that have been important all along the way. We're really looking at a commitment to equity and social justice, as outlined in the strategic plan and the vision and the goals that Shukri outlined. This is so important to this work also. We want to ensure that your project or your innovation is meeting the needs of the stakeholders, of the communities that you decide. And we're also prioritizing thinking about the most underserved communities or communities of color. Also, again, just ensuring that if you're creating an innovation, that the population that you're being served or you're proposing to serve is meaningfully engaged, that they're in a co-creation, that they're helping shape the solution and shape the innovation as they know best. So we also know that for this innovation that there's lots of important priorities that we want people to be considering along the way. And we're going to ask that each potential grantee or organization outlines one of these, chooses one of these priorities and talks about how it aligns to their work. That it's either, so the innovation priorities that we've outlined are that it strengthens or extends a program or strategy in a new or different way to provide a solution identified by the community being served. That your innovation finds a unique way to support those children who are caring for support those who are caring for young children and families, and provide them with the supports to learn from peers and for formal trainings in a way that work best for them. Again, that co-creation. That is designed with co-creation that innovates input from both community and providers, and that has a plan for ongoing engaging with community along the way. That it uses a combination of science, evidence-based, but also community-informed science with identifying solutions that work for the communities. That it furthers equity and social justice through program innovations and meets the needs of marginalized communities, including communities of color, immigrant and refugees, LGBTQ communities, and those with special needs. We're also looking for things that build on grassroots approaches to make systemic changes within systems that work with young children and families. We also have another priority on focusing on one or more of the 3 principles to improve the outcomes in children identified by the Harvard for the Center for the Developing Child through Harvard, which supports responsive relationships, reduces sources of stress, and strengthens families and strengthens families, the core to families. And I'm so excited to let you know that we have more information on those principles. You'll have the opportunity to meet the team today. I'll introduce them. And you also will have an opportunity to hear more about those principles in another webinar later today that will be linked to the webinar here. So we'll go to the next slide. So the RFP was already issued. It was actually issued on July 21st. June 21st, sorry. I'm in July. It was issued June 21st, and today is June 27th, our webinar. Tomorrow, we're going to have an information session in Renton. You also will have a July 6th, an opportunity to meet in person in Skyway at the Skyway Library. RFPs are due August 8th. And we will be letting people know in the middle of September, and October 1st, you'll be ready for contracting. And again, it's so critical to note that every single person that is awarded the grant, an awarded grantee, is required to join us in our October training on October 15th, 16th and 17th, or 18th and 19th. So please mark those dates. Another key piece to this that's so important is that we have an opportunity for you to get technical assistance in your grant writing. And within our RFP, we outline how you can do that, and we really encourage you to utilize this opportunity and engage with those technical assistance providers. They're very helpful and will get you the information that you need. So this time, we're very excited. We're using Zoom Grants. Zoom Grants is an online approach where you have to log in. What you'll want to do is ensure that you're using, you look at the questions in the Zoom Grants, you get an email, you register, and then you'll want to look at the questions and actually probably type up your questions in a Word document and cut and paste your answers. This will help you to ensure that you can meet the word requirement. Zoom Grants will only let you have so many words. We don't need 100 pages, but we want to hear your good information. Again, we have a 3-year draft budget that we're asking you to propose. Again, this isn't scored. We really want you to be thinking in advance, but this is not an area where I would prioritize my time. I think you just need to be really thoughtful and have a good plan, but recognize it may change and will also be a requirement if you are an awarded grantee. If you have questions beyond today, you can submit them in our Zoom Grants through the FAQ system, and we will ensure that your questions are answered. And every week you can check back on the FAQ or the questions, and all the answers that we share with anybody will be posted. So everybody gets the same information. Next slide. So again, I talked about earlier that we have 3 science concepts that can help you think differently about solutions for early childhood programs and innovations, and we're going to have the opportunity to partner with them. We're so excited. We have 4 key people from the Frontiers of Innovation, and we'll be partnering with them. We have Al Race. He may be able to, the team may be able to join, they may be able to wave to us. We can see if they can try. But Al Race is the Chief Knowledge Officer at the Center for the Developing Child, and he's been there for 12 years, and he's going to help in this process in October will help present the information and help us learn the best way that we can complete our innovations. And he is helping improve the understanding and application of the science on early childhood development in policy and practice. And with Al, we also have Melissa, a senior project manager at the Center of the Developing Child, and she is the lead of the Washington cluster a long time and has been doing work a long time here in Washington with many different programs. And she's a project lead for Frontiers of Innovation within Washington, as well as Colorado and Minnesota. Locally, we have Holly Schindler, an assistant professor at the University of Washington, and she serves as the co-lead for the Washington cluster. And she's going to be really important when we learn about the Ideas Impact Framework if you are selected to be a grantee. And we also have Jason Gortney, who is the Director of Innovation at Children's Home Society of Washington. And he has been working for a long time on co-creating and testing more than a half dozen new practices and models aimed at improving outcomes for young children. So we feel really honored that you'll have the opportunity to, if an awarded grantee, to really gain some great insight from our partners at the Center of the Developing Child at Harvard University. So it's really exciting. They look forward to partnering. I don't know if they can wave to us. Doesn't look like it. Again, you'll have the opportunity to hear another webinar that will be linked, and they'll talk about those science concepts. So I'm going to turn it over to our evaluation partner, Sarah J., who's going to tell us all about how you can work with us on data and evaluation. Thanks, Sarah.
Thank you. I'm going to talk a little bit today about some ideas for incorporating data into your proposal, and then briefly just tell you a little bit more about what you can expect around evaluation if you are awarded. So I'm an epidemiologist here on the Best Starts for Kids data and evaluation team, and our team has 3 principles that we hope you'll see reflected in our work together, which are partnership, collaboration, and accessibility. So starting off with thinking about putting data in your proposal. This is a really exciting RFP, I think, because lots of different kinds of projects can fall within this category of innovation. And that means not everybody who reads and reviews your proposal is going to know a lot of in-depth about the topic or the community that your proposal focuses on. So you need to find a way to tell the story that's going to be really compelling, and data can be part of helping make that story concrete for people. We recommend thinking about what's that big overarching story about why your project is important and how your organization can succeed in helping families. And then once you have that kind of your big framework in mind, think about what information could help back that up. And then go out there looking for it. And we'll talk a little bit about some places you might be able to find it. But first of all, when we talk about data, what do we mean? Most people think of numbers first, and numbers are an incredibly rich and useful source kind of data that we work with. But it's not the only kind of data that Best Starts for Kids values. You can use images and words like stories or quotes from your clients or your partners as well. And that can really be a really rich way to help people understand kind of the story behind the numbers. And it can be really useful too, because we know that for a lot of communities might not see themselves reflected in the number data that we have available. So when we say data, we mean a really broad view of what kinds of data that we hope you'll consider using in your application that will be compelling to reviewers, and not just data from King County, but your own information from the community as well. So think broadly when you hear us say using data. So there's a couple different data sources that King County, as I mentioned, is making available. And we want to take a minute to talk a little bit more about these so that everybody knows what's out there and hopefully feels comfortable taking a look at it if indeed you feel that it could be useful to help you as you work on your proposal. But with that being said, I think it's important to remember that these are not the only important sources of data. And nobody's going to get scored based on, did you come to our data sites or anything like that. So again, our goal here is that everybody will have kind of an even footing that it's out there and how to start using it if you are interested. So one is our Best Starts for Kids indicator page. And this is something that this idea of indicator is something you've probably come across if you've been paying attention to Best Starts for Kids for a while. And this is part of our evaluation framework where we're looking at the really big picture in King County. And an indicator is a topic that we're measuring that at the population level across the county that can give us information about how we're doing, what are the needs and strengths, and over time, perhaps synergistically, the different strategies of Best Starts for Kids will help to actually see some change on some of these topics. So you can find out the data for all of these indicators at the Best Starts for Kids indicators website. And let's just take an example. I will say there's a little caveat, a tip that I would share for using the search bar, which is that it will search only for the exact words that you use. So let's go ahead and type in there screening. And this is just for an example of what I mean by that. If you were to type screenings and the indicator said screening, it wouldn't come up. So there are some limitations to the search bar. But when you see an indicator that you're curious about, you can click on it and it'll take you to this interactive visualization where you can see how the indicator looks across King County. Usually a map is the first thing. As much detailed information as we can, because we know that for many communities, the more detailed the information that we can provide, the more disaggregated data we can provide, the more useful it is. Here you'll just see broad regions of King County, but depending on the data source, sometimes you can look in more specific communities as well. And the other thing I really want to point out is clicking on this demographics tab. And this is where you will be able to see, again, depending on where we're getting this data from, you'll be able to see breakdowns by often race and ethnicity and sometimes different socioeconomic measures. And you'll see the geographies here as well. So this particular indicator comes from the Best Starts for Kids Health Survey. So we had some more detailed race and ethnicity categories than you often see. That can be useful. We've got language spoken at home, which again, you don't always see. So this is a good place to come to look for data specific to your community if you're not just focusing on a geographic area. Again, that being said, we absolutely know there's limitations to what data we have for a lot of different communities. So consider using what you know, whether that be stories from clients, whether that be numbers from surveys that you've done, or numbers that show the success that you're building on in your program work so far, things like that. So let's jump back over to the PowerPoint. I do want to mention quickly another place to look for data for King County that may be helpful to you is the Communities Count website, communitiescount.org. And that one has is not specific to Best Starts for Kids, but it has some good just general population data, and it has some more writing in there. So if you do not enjoy digging through those charts, that's a good place where you can go and just find some simple sentences that explain what the data is saying. So thinking ahead to evaluation, as Shukri mentioned, this is an important part of Best Starts for Kids. We want to be able to show the impact that our efforts are having. But with that being said, you don't need to worry about developing an evaluation plan for your proposal. It's one of the products that phase one of this particular program of the innovations, as Marcy explained, you'll be able to work on that together with us and with the Harvard Center for Developing Child Ideas Framework. if you're awarded. So what we need to see in the application is that you are willing and excited to participate in that evaluation planning process. You can include some funding in your draft budget that you put in. Very often this is for staff time to do this kind of data gathering and reporting, but it doesn't have to be limited to that if you have other ideas. And know that we will be asking you to share data to so that we can collectively track progress and outcomes and learn from each other about how things are going along the way. So that's a little bit more about what to expect of the evaluation. And now I'm going to hand it back to Marcy, and I think we'll have some time for questions and answers.
So Shukri and I are going to attempt to answer, we will answer all your questions that you may have about the Innovation Fund. We'll work together to figure out, so you can type in your questions. Aaron just, there's somebody is typing a question. We'll read it out loud to everybody and then we'll attempt to answer it.
We have also given you the option to unmute yourself. So if you are on the phone, if you unmute yourself, you can also ask a question over the phone.
It looks like many people are typing questions, so we're just waiting.
Oh, hi. I'm Julie Wilchins with United Indians of All Tribes.
Hi.
I had a couple of questions about eligible projects, and the first question was, does the project we propose, can it be an existing project that we're planning to take a new approach with, or does it have to be a brand new project?
That's a great question. It can be an existing project that you're doing a new approach with. You want to be thinking about, I think the most important piece to know is that your solution is co-created with the community that you are hoping to be serving.
Okay, got it. And on a related note, I thought I had read somewhere that we might not be able to propose things that were eligible for funding under other Best Starts for Kids RFPs. Is that the case? Or if a program might also be eligible for funding under a previous BSK RFP, could we also propose it for this one?
So if I'm understanding your question, you would not be, if your program, if you decided to do the Marcy Shukri program and it was funded already in Best Starts for Kids, it wouldn't be eligible here. We're not going to be funding, but if you are proposing something, it has to look different than what's been already proposed and that has been funded. If it's already been funded, it would have to be different. Okay. Does that make sense?
Okay.
If you
so it could be kind of a different new piece of an existing project that is being funded.
Okay. Absolutely. Absolutely.
Okay. So you have a new approach. It could be the same project, but a new approach.
Got it. Okay. Thank you.
Thank you, Julie. Okay, I'm going to read this question. Let's see. Sorry, there's some echoing. Most of the recent RFPs have significant overlap. What is the main difference between this funding opportunity and the more recent RFPs? And can we apply for a similar project as we did with others? That's a great question. So we've had two other projects that also have asked for some innovative approaches. We had a program that was specific to our home-based services and to our general parenting. This has a similar approach, but we are going to be working with different capacity builders through our Frontiers of Innovation, which is really, they're really through the really experts in thinking about how do you bring your innovation live and bring that approach live. The difference between this is that if the home-based services was specific to only home visiting or home projects in the home, this FO, through this innovation, you can apply for a program working with children and families that meets the needs of the communities. You can apply for a systems change, like we described, and you can also apply for an approach to improve professional work or peer-to-peer learning. So the difference is really around, and we value co-creation, which other approaches do as well, but the difference is that we have different people working with us, or different approaches to working with us, and that it's not to a specific area.
Mm-hmm. The second question about, can we apply for a similar project as we did with the others?
You can, but what we really want you to be doing is looking at the values that we outlined, that you have to have an innovation value. We want you to co-create the innovation values. Let's see, this is great, that we have an existing, maybe go to the third, 2 more slides. Sorry, thanks everybody. Yeah. Right here. Yep. Yeah. So your innovation has to fall into one of these 3 categories, that either is supporting children and families, that's supporting service providers, or changing systems. If you've applied to a different RFP and it's fit into one of these categories, you could apply again if you haven't been awarded for that. If you were awarded, if you, for example, got awarded to do the Marcy Shukri program in the home-based services funding, it would have to look significantly different. It would have to be a new approach, meeting a different community or a different need. Does that answer your question? Okay. I think. So another question is, do you already have to have partners before you apply? In the changing systems, it talks about you can have non-traditional partners. You don't have to specifically have all your partners lined up before you apply, but you need to have some good ideas around what they may be. And it also, again, has to be generated with that approach that you're using community voice to identify who those partners might be. We understand that along the way, you may be, part of the approach is that along the way, some of your partners may need to change because you're going to be learning along the way what is working and what's not working. So you may have to add additional partners along the way. But we do want you to have a good idea initially around what you're thinking. So we have some more people typing questions. Shukri, you can see better than that.
Yeah, a few more typing questions.
Okay. I don't think it showed up. Let's see. Oh, there we go.
For changing systems, can you look at a wider project that includes both families with young children and a more general population?
So when we, that's a really great question. The focus of this work really needs to be on the community for the prenatal to age 5. We recognize that families have 6-year-olds and 7-year-olds and 8-year-olds as well, but the main focus of your solution and intervention or innovation really needs to be focused on the prenatal to 5 population.
Great
primary.
Question. Yeah.
So it could be inclusive of a more general population, but again, the main focus on that prenatal to age 5. One of the first questions that will be you'll be asked in Zoom grants is, does your innovation touch or really serve children and families prenatally to age 5?
Any other questions?
We'll wait a few minutes.
Yes.
Because you can unmute yourself again if you would like to ask other questions. We have another question that's being typed.
Could you tell me the process of accessing consultants, so the TAs?
Yes. The technical assistance, that is a great question. I'm pulling up my information right now. There is actually a link on the RFP embedded in Zoom grants that shows you how to contact each of those providers. What we can do is in Zoom grants, we can list them all for you in the FAQ as well. So we can do that. We want to follow up on that. What you need to do is you email and contact the technical assistance providers and give them at least 24 hours. And they will respond to you and ensure that you have somebody to talk with. But we will list all of those names within Zoom grants on the FAQ.
And you can contact any of them directly.
And also just to note that it's available in multiple languages, including Spanish, Vietnamese, Somali, Swahili. And you can access that technical assistance up to August 6th. And 2 days before the application's due, we will request that there's no more questions to our technical assistance providers. So you'll want to be sure to contact them earlier than later.
Is there any limits on hours, amount of services we can ask?
Let's see here. Okay.
To TAs.
For technical assistance. Our technical assistant, I don't think there's, that's a good question. We don't have any limitation on the amount of hours, but our technical assistance providers have clear boundaries. They can't write their RFP for you. But what they can do is ensure that you're meeting the needs, that they can ask you good questions to help you refine your RFP. They can do some review of that, but they have a good process for ensuring that they stay within the scope, but it's not necessarily limited to hours. And it has to be in regards to the actual RFP that is open. I'm not sure if that gets to your question. One more question's coming. Okay.
Do you have a preference for the size of organizations that might be awarded this grant? And would very small nonprofits or even volunteer organizations, associations with a nonprofit be considered?
So we don't have a size preference for who would apply for this. We want to ensure that if you look at that, the value or the priorities outlined, we will be looking at that, which are again that there's co-creation, that you are working with the communities, but we don't have a specific actually, if you go a little bit further, Sarah, sorry, we can pull it at fourth slide. Next one. Actually, even the next one. There you go. So these are the funding priorities, and the previous slide also has those. So we do not have a preference on your size, but we really want to ensure that you have a innovation that is meeting the needs of the community that you are proposing. So that would be what you'd want to focus on. And
that sort of builds on grassroots approaches, that is community-driven, community-led effort.
yes, that is right. There's not a size preference.
There's not a size preference.
Looking at the eligibility here. There's another question coming.
While you look, maybe I'll read this question.
Yeah.
Are collective impact partnerships working to shape systems for better outcomes for children birth to 5 be eligible? The proposal would include funding to support the backbone convener.
So that is a good question. I'm going to look up, I want to read something to everybody where the eligibility is. Which is not in here.
Oh, is it
Right here,
this?
yep. So this is really open for nonprofit organizations, community-based organizations, tribal organizations, schools, school districts, public or government agencies serving communities, small nonprofits, community-based orgs, and those serving most impacted by health and well-being. So as long as your backbone convener was one of those, you would be eligible.
Great summary. Can you give a more specific example of the type of innovative projects you're looking to fund?
So this is a really good and difficult question. I think that the challenge with this innovation fund is that we really want it to be coming from the community. Therefore, we can't give you specifics exactly what that would look like. Again, I would say that it has to either be one of three things. Working with children and families, prenatal to 5. It has to support professionals, like childcare teachers, home visitors, to ensure high quality in a different way. So that could be peer learning or training in a different way, as long as the service providers are part of that solution. Or again, funding efforts to break down institutional structural racism, and building upon with new or traditional partners, and again, ensuring that the community that is part of the solution. So, and again, really good question, but we don't have, we want to hear from you what those innovations are that are in your community. We know there's good work happening out there, and we also know that there's good ideas out there. So we want to have it open for your good thinking.
Mm-hmm.
Do you have anything, right?
Yeah, that's good. Redirecting. You give us examples of the type of innovative projects you're working on. Any more questions?
We'll wait one more minute and see if anything else pops up.
Mm-hmm.
So we really appreciate your time today. We'll see you in, again, the 2 opportunities to come talk to us in person. This will be recorded so you can share it with your colleagues and friends. And additional our webinar will be available for you to learn more about the science behind innovations and the principles that are outlined in the priorities. So that will be linked, and you can ask any more questions in the Zoom grants, and we'll be sure to get back to you.